The health department says it knows about the discrimination against groups with high HIV infection rates at clinics, and it has training programs in place. Joining me via Zoom to discuss how those training programs work is the acting head of HIV in the National Health Department, Dr. Thato Chidarikire. Thato, thanks very much for joining us. Who gives this training? Is it the health department or do you contract it out?
It's both. Health department has regional training centers, but a lot of our partners have training units. So most of the dissemination is through partners, but the Department of Health also does some training.
So if you could just break down this training for us, what is it that you teach health workers that lead to the change in their attitudes?
So we developed a curriculum. So it's a training curriculum. It has a participant's manual and a facilitator's manual. So it's a full curriculum. And what we train on it is, well, the first few chapters have introduction to basic HIV, symptoms, the basic information. And then as you move through, it actually starts talking about how to actually deal with clients and especially key populations, our different types of key populations. We have our LGBTQ, we have our sex workers, we have our MSM, but basically to say, do you know the difference? Do you know if one says, I'm presenting as MSM, do you know what that means? So that they know, how to respond as healthcare workers and how to manage the situation.
Just to clarify for our viewers, the MSM that Thato referred to here is men who have sex with men. Thato, let's apply this information that you've given to a specific example. Let's, for instance, say there's a doctor who sees a transgender patient and argues that the transgender patient is just confused about their identity. What would you do to change their attitude and treat the patient properly? What is it that you're going to teach them specifically so that they don't discriminate in that way?
So the good thing about this training curriculum is that it has video clips.
There are challenges that they meet, and
it actually has individuals, live individuals with experiences. We do have a chapter that talks to transgender persons, and we have an individual, a transgender person, who talks about their experience in the facility. For example, there's an individual who comes through. She's a trans woman. So she went into a facility for circumcision, because remember, trans women born men and then is transitioning. So she comes through and the doctor says, but we don't do that with women. So she has to now explain that I'm a trans woman and explain what that is. So going through that, it's like then the doctor then goes out, another doctor comes in, how they will go in and out. It's basically in the curriculum itself. It's a very good example of now somebody saying, almost like doctor says, come and experience what I'm experiencing. And she is there and she's trying to get a service that she's trying to get.
Earlier in our program, we spoke to an author of the Ritsitsi State of the Healthcare Report for Key Populations. And one of the recommendations of that report was that the health department should have sent out by the end of February a circular to all clinics that would explain that people coming from populations we've discussed with high HIV infection rates should never be refused healthcare to clinics. Have you done that?
I can confirm that that circular was signed because I signed it. It was signed and sent out.
Have you had a chance to investigate any of these cases of discrimination that the researchers told you about in their report?
So as national, where we are sitting or within my office, we have not necessarily gone out to investigate per se, because implementation goes on or happens at a district level within the provinces. Then that's where the investigations are supposed to go through. What we do is we follow up to look at what the challenges were and whether the challenges have been, especially the systems challenges, because that's where we have power. And then, for example, if a report says there hasn't been any training or trained nurses, we will ensure that there is capacity building.
So if a worker is found guilty of discrimination against one of these groups, what would happen to them?
There would be, as we say, an investigation and then the root cause, because that's where we start. To give an example of KZN province, where we went to facilities and we would talk to healthcare workers and say, so what do you think about the training? What is happening now? And you would find that, a healthcare worker would say, I did not understand the transition because this kind of information is something that I was never exposed to. Or that judgment of a sex worker or a man who has sex with men. That's what we are saying. No, you don't judge because it's not even your job to judge. Not that anybody has a job of judging, but as a healthcare worker, that is not even part of anything. You give the services that you need to give without any judgment.
Dr. James Oladipo, who we spoke to earlier in this program, pointed out that many people, the majority of transgender people who they interviewed, said that they wanted access to hormone therapy. But this therapy seemed to only be available at large institutions in cities, and in rural clinics, they really struggle to access it. How can you change that?
This is a specialized therapy, and it's not the kind of therapy that you get over the counter. It's scheduled, and it also needs support, a psychosocial support. So that is why it's in specialized facilities like your tertiary hospitals. So what we may need to do, right now we are saying that we should bring services to the people, just like our national strategic plan, our HIV plan, actually says it's more kind of like community-centered, community-led. And as we move towards 2030, we want to ensure that every individual is brought into the services, into care, self-care even. We would be able to, move other interventions towards the communities. However, when one thinks about moving an intervention that out of a clinic or a hospital into the community, we need to be able to talk about the infrastructure, the training. How is that going to be done in a safe manner? So it is work in progress. I'm not going to be saying it's never going to happen, but it is work in progress.
Dr. Thato Chidarikire from the National Health Department, thanks very much for joining us.